All right. Well, welcome. Thank you all for joining us today. We appreciate you joining on camera and virtually. We have Leah Snyder, our superintendent, joining us today, and she's going to give us some updates budget-wise, waiver cost, um, just updates on that end, and then our building move, and then we'll move on through the rest of the agenda.
All right, thank you, Karen, and thanks everybody for having me. Um, I will open with a PowerPoint presentation here in just a minute. I'll ask that you give me a little bit of grace. I decided to make edits this morning. I had it ready to go yesterday, but you know how that goes. So if I have typos in there or you catch any of those, I'll correct those later. I'm going to start with the building updates because I think that will be the shorter part of the conversation, and then we'll move into the finance portion. I do want to let you know I am very open to questions. It's hard for me to see those as I'm going through the presentation. So if I don't catch them during, I'll come back to them afterwards, but also feel free to unmute yourself if you want to ask a question as I'm going through everything. All right, let me get this going.
No, yeah, Catherine, as we've seen this.
Okay. Karen, I can see you. Is my presentation showing up?
It is, and it looks great.
We can see it.
Thank you. Okay, so again, starting with the building, we're moving, but not quite yet. So where are we moving to? Hamilton County Central Campus in Bond Hill. The address for that will be 1701 Patricia McCollum Way. We'll be on the fourth floor there. When you enter the building, there will be wayfinding signs to help you get to us, but there will also be people that will help you find your way. Who is moving? We have most of our HCDDS staff. The only ones who won't be moving are those who are working in our school programs. We're moving in spring of 2026. We don't have our exact date yet. So we are watching. There's some construction that needs to happen in the building, primarily because it was one big office building that had all floors were completely open. And because multiple agencies are going to be there, they're building around each elevator bank and stairs. They're building it out so that, only those agencies that are on that floor can access those. So some of that construction is happening. And then in terms of, oh, I did want to make sure you've probably seen notices, but I wanted to highlight Kingsley. Our Kingsley location will be closing permanently on February 17th. So people are communicating, sometimes rescheduling or moving meetings. Most of our operations will move temporarily to support center until we move to Bond Hill. So the support center, we haven't announced when we're closing that yet, but after we move, both Kingsley and support center will be closed. Those buildings are being sold as part of the process. So the reason that we're moving, there are many, but this really aligned with a lot of things we were looking to do. A big one is the building has great accessibility and parking. It's very easy for people to navigate. We're consolidating our offices, which will allow us to save money over time, which is something that we are focused on. It puts us closer to some key partners, and we think that it'll provide a very welcoming space for individuals, families, and all of our partners. A little bit of information about the Hamilton County Central Campus. Again, I gave you the address. That road was actually renamed to honor Pat McCollum. She was a local foster parent and social worker. The departments that are going to be included in there, I mentioned that we will be closer to partners. I think this is a really big benefit of this. I named some of the ones we work with most closely. There are some other organizations, but the ones I listed here, Job and Family Services, Public Health, and the Veteran Services Commission. Those are organizations. Many of those in the building will be focused on community service and social services. So it will be nice to be close to those organizations. The move-in will be phased, so departments will move in at different times. JFS is actually moving in early 2026. I think their date is already announced. I can't remember what that is off the top of my head, but it's very soon. And then we'll be moving in later. We'll be moving in spring of 2026. So we are excited, looking forward to that. If you're not familiar with that location, it's actually the old Mercy Health corporate offices. So if you're familiar with where those are, that's the building that we'll be moving into. So any questions about that before I move on to talk a little bit about waiver costs and our budget?
There's nothing in chat currently, Leah.
Okay. All right, thank you. Then I will move on to the next part. So I just wanted to start with an overview of our 2026 budget. Some of the key takeaways as we passed that budget, our revenue is up about 4%. Our expenses are up about 11%. It doesn't take a strong math skill to see that our expenses are outpacing our revenue. We do still have a cash balance, but we're expected to spend that down quickly over the next few years. And so that's something that we're watching very closely. We know that we need to look closely at both our revenue and expenses to make changes to ensure that we're stable and sustainable. Wanted to give a breakdown of our revenue and our expenses, but our revenue is mostly our levy. That does provide most of our funding, which about 75% of it. The rest of our funding is made up of some federal and state funding, but really that some other miscellaneous funding, tuition for schools, that sort of thing. But most of our funding comes from the levy. I think this is an important thing for all of you to know, and we want to make sure that we're communicating this with people in the community. We have what's called a fixed sum levy, and that means that we don't receive inside millage. When property values increase, we do not see any additional funds. So what happens is as property values go up, our millage, the rate of it is reduced down so that we're receiving the same amount. That's why it's called a fixed sum. We only receive this amount that has been voted through. And so I think a lot of times people think that as their property taxes rise, as they're paying more, that any levy organization is getting more funding, but that's not the case. Unless they're receiving inside millage, their funding is staying flat. So our levy last passed in 2024 as a flat renewal, so there were no new funds with that. I talked about how the millage gets reduced in terms of the effective rate. So we have voted millage at 4.13 mils. Our current effective millage is at 2.51 mils. So our levy today brings in $79 million. Our levy brought in 2010, $78 million. So you can see a little bit of growth. That's primarily due to new builds. That's where we would see any increased funding from the levy. In terms of our expenses, that's mostly waiver match and personnel. Our waiver match is our biggest expense. It's over 50% of our budget. Waivers are partially funded by the federal government, but they require a local match. And that's about 35% of all the waiver cost. That is I think one way to look at that is for every dollar we're spending in that local waiver match, we're bringing in an extra $4 to $5 from state and federal resources into Hamilton County to provide services. County boards are required to pay their portion of the local match in Ohio. When you look at the total number of people we serve, about half of them are supported by waivers. And as many of you know, waivers are a lifetime commitment. That doesn't mean everybody will maintain their waiver for their life, but it really is a lifetime commitment unless something changes in their situation. There are very few reasons why somebody would come off of a waiver. The other thing to keep in mind is that the rates and rules for waivers are set by the state and federal government. So while we are the local administrator of those funds and we fund a portion of those funds, we really don't have a lot of control over decisions about how those are implemented because we're required to follow the rules that are set for us. The second biggest expense is personnel. That's about 40%. I do want to make sure that I point out that most of our personnel cost is to support services, things like early intervention, the schools, and SSAs. Our administrative cost is low, and we have to be reviewed by the Tax Levy Review Committee. And our last consultant determined that when you compare us to other counties, our personnel costs are low. We're very lean compared to similar counties. So I want to get into waiver costs. As I mentioned, that's the largest line item in our budget. So in terms of what affects waiver costs, we look at a few key levers. There are a lot of variables, but I narrowed it down to really the top 4 things that impact them. So the one that of course makes sense is the number of people that are served by waivers. As we have more people, obviously the cost is going to go up. The rates for Medicaid services. As many of you know, the rates did go up in the last budget. We supported that and believe it was necessary, but that does add cost to our waiver match. The other thing is the federal match rate, which is the percentage of Medicaid that the federal government is paying. During the pandemic, they increased that amount. So they were paying a larger portion of the cost, which meant that our costs were lower. So even as our waivers continued to grow, we were paying for less of that cost because the federal government was picking up a larger portion of that tab during that time. We did know that. We were monitoring that very closely, but it sort of camouflaged some of that growth if you were just looking at our budget overall. And then increasing authorizations for those already served on waivers. Many times that's because people's needs change over time. Services change over time. You know, there are changes to the waiver rules. So as authorizations increase and go up, that also increases our waiver costs. I put this in bold. It's pretty shocking, I think, when you think about how quickly this happened. But because of all of those factors, our waiver match cost has doubled in 3 years. We're serving more people, the rates are higher, the needs are higher, and the FMAP is lower. So overall, there has been a significant increase in our waiver match for those reasons that we can point to pretty clearly. This is really just a chart to show you the impact of that. So if you see the yellow portion, that is our tax levy revenue. If you remember, I said that that has stayed pretty flat at right about that $80 million mark. When you see how that compares to our waiver match, you know, in 2020, we're looking at that being about half, a little less than half actually. It continues to grow, and then when we see the rates increase, it is taking up a much larger portion of our tax levy revenue. Again, we think that the rates didn't increase for a long time. Those rate increases were really needed, but that's the biggest reason for that, along with some of the other things I talked about, growing needs and that sort of thing. So it's really just important to keep in mind that we do want to, on our end, be as efficient as possible and cut wherever possible. But as you can see, there's really not a lot of wiggle room when our waiver match is taking up such a large portion of the tax levy revenue that we receive.
Leah, a question did come in.
Yes.
Is the 79 million levy dollars both operational and capital, or just operational?
So we don't have any capital levies. So that's our total levy revenue. The funds are used for really all operational costs. That includes waiver match, that includes personnel. Now, the reason you might say, well, if you're at 100%, how do you have any funds? Remember, there are some state and federal funds. For example, we bill for some of the administrative services that we provide. Doesn't cover all of our costs, but it covers a lot of it. We charge tuition for our school services, so we're able to cover a lot of the school cost with the tuition that we charge. So that's how we're able to operate operationally, even as the waiver match grows. But there's still not a lot of wiggle room for that reason. Does that answer that question, whoever asked it?
Yes, this is Ryan Knodel from Benchmark, and so thank you very much. That did answer it.
Okay, great. So just to summarize, our costs are growing quickly, mainly driven by waiver match. Our revenue has been flat since 2010. With current trends, we're looking ahead. We project regularly and update those projections. We are projected to run out of funding before the end of our current levy cycle. So with that in mind, we do have some time, although it is, you know, we have to adjust quickly, but we're adjusting and looking at both our expenses and revenue to develop a plan for the future. So I just wanted to provide some examples. This is definitely not an exhaustive list, but we're really starting by looking at ways that we can reduce cost right away. Some of these are easier, some of them are more difficult, but we want to make sure that we're impacting as soon as possible as we continue to analyze and find other methods. So we're thoroughly reviewing all of our vacant positions before filling. That means some of them will go unfilled or be adjusted before we would refill. We're trying to make sure that, again, we're already lean, but we want to be as efficient as possible. We're reducing leave payouts and other reimbursements that go to our staff. We're focused on maximizing any billing and grant revenue that's available to us. We're consolidating our office spaces, as I mentioned. We're renegotiating and reducing contract cost. And when I say that, that doesn't necessarily mean service costs. I mean, we'll look at every contract, but that also includes things like our phone bills and our copier contracts and any of those kind of contracts. We're really just taking a look at everything. We're reviewing our authorization practices to ensure they align with the rules and they're consistent. I do want to talk about this one because I want to make sure that I'm very clear. We don't have a set amount where we're saying we have to reduce our waiver costs by this much because we know that waiver costs are driven by needs. And our goal is definitely not to stop meeting people's needs. We exist to meet people's needs. And so our goal, though, is to make sure, are we authorizing at an appropriate level, and are we being objective and making consistent decisions about how things are authorized, and do they align with the rules that we're required to follow? We're just making sure that that's as clean and tight as possible as we move forward. And then we're evaluating the efficiency of all of our programs. Again, just looking for opportunities for cost reduction. Current work and next steps. We're tracking the impact of all of our cost reductions that we're making. We're finding additional ways to reduce cost. We are developing contingency plans. So what does it look like if we continue to have this growth that we're anticipating? If we, even if we stay on the same track we're on, we still need to have contingency plans for how we will continue to meet needs and provide services. We're keeping the Tax Levy Review Committee and commissioners updated on status. I've talked about the Tax Levy Review Committee twice, just to make sure everybody knows that is a group that's appointed by the commissioners, local community members, and their role is really to evaluate all levies and make sure that they're balancing the burden on taxpayers with the community needs. And so on a regular basis, the Tax Levy Review Committee is reviewing our work to make sure that we're doing that. So we're keeping them updated as well as the commissioners on our status. We're advocating for changes at the state level. We think that I probably should have said this sooner, but this is not unique to Hamilton County. In fact, there are counties that are experiencing greater hardship just because they're a little further along in terms of their impact on finances. And so we're advocating at the state level for changes to help the whole system be sustainable. And then we're planning for our levy process and what that looks like moving forward. All right, so I know I moved through those pretty quickly, but I wanted to make sure I left enough time for questions. That's really the information that I had to share with you. Does anybody have any questions for me? Okay. I do think that I'll make it a regular habit just to come back and provide updates and make sure that I keep everyone as informed as possible. If you think of questions, again, we want to be very transparent. We want to make sure that everybody has the information they need. So anytime you have questions, feel free to reach out with those. Always willing to answer those and want to make sure we're keeping people updated. Okay, I do see a question that came in. What's the best way that providers can assist? I think that's a great question. I think, first we're looking inward in terms of what we can do, but I think that, that's a great point that we can look for ways that providers can assist. I think that probably the way that makes the most sense is that as we're doing some of that work to make sure our authorizations are appropriate, we certainly want you to be involved and share concerns if you have them, ask questions if you have them, all of that. But just keep in mind that our goal is not to save money for the sake of cutting cost, but to make sure that everybody who needs services has access to them. And so, again, that doesn't mean that you just have to agree with us every step of the way, ask those questions and that sort of thing, but know that we are trying to make sure that we're following the rules and that things are appropriate. So that's something that you can do, keep in mind. I think, right now there's a lot of concern around property taxes, and I think that's legitimate concern. I don't want to minimize that at all. I think there are very real reasons why people are concerned about that. I would just say that not everybody understands how our levy works. And so just from an awareness perspective, if you hear people talking about like, well, how could they struggle with money? They've gotten all this new money from property taxes. Just making sure to keep in mind that we don't see any increases from those property tax increases. And so if you hear that, being a voice for that. And then just in general, I think that we do really great work in Hamilton County on behalf of people served and families. And when I say we, I don't mean just we, the county board. I mean we as a system, as providers, as partners, as people in Hamilton County. We provide great services. And so I think just speaking up about the good work that you do and the good work that we're doing together is a powerful way for people to recognize the value that we offer and just know that we're doing the best that we can and that we're planning for the future and trying to make sure that those services last. So those are the things that come to top of mind, but I think that's a good thing for us to continue to think about too. All right, any other questions for me? All right. Well,
Thanks
thanks,
so much
Karen.
for
I'll hang
joining
around for a
us.
little bit until my next meeting, so I'll be on here for a little bit if anybody has other questions that they think of later.
Perfect. Thanks so much. Teresa Schlimmer is one of our benefits analysts. She's up next to talk about the payroll information exchange.
Hi, everyone. My position here at DDS is with the Social Security Office in doing benefit analysis. I went black. Can you still see me? Oh, you
We can.
have that letter.
I'm
Okay.
sharing the letter that you
Okay,
have.
thanks, Karen.
Uh-huh.
So what is happening is at the Social Security Office, some of our people, not all of them, are receiving letters that state that their employers are now reporting their wages for them. We need to ensure that people do not, in addition, report those wages themselves. What is happening is if they report those wages themselves and they're in the payroll information exchange, they're being credited twice for income, which can throw them into a non-pay status if you're on Social Security, and on the SSI, a tremendous reduction in their monthly benefits. If you see this happening, what I'd like you to do is to reach out to that person's SSA here at Hamilton County, and then they will reach out to me. We have a system in process to help with overpayments, termination of their benefit check, and I am the person that can assist with those. I learned this in October when I went to my conference in Colorado. This has really been a huge problem. I've been working on overpayments most probably in the last 3 weeks. I've had about 10, and it's all because of this payroll information exchange. And I understand people got nervous when they said, don't report, because all we've ever told them is report your wages, report your wages. Well, some employers have jumped on board with this payroll information exchange, and it's totally employer based. You can ask your employer if they will do it, and some of them are approved to do it through the Social Security Office. But for the most part, they really need to stop reporting if they get this letter. If you do not know, I know I'm opening up a big can of worms, but I'm willing to do this to save future problems down the road for income for our people. Have them reach out to their SSA and say, I might have got that letter. Can you check? And I can check. I email the Social Security Office. I have a direct contact at the Social Security Office. I email her every Thursday morning and ask my questions, and she's pretty responsive. I usually have them back by noon, and she can tell us if that person is enrolled or not. Do I want you to send me everybody that you serve that's working? Probably not. But if you think somebody's check is being impacted by a double income reporting, please let the SSA know. Questions? Nothing, Karen?
Nothing's coming through. Thank you so much for joining us, Teresa.
Okay, well, I'm logging off. Thanks,
Thank
guys.
you.
Bye-bye.
Jan, you're up next for waiver and state updates.
All righty. Good morning, everyone. I don't have a ton for you this morning, just a couple of quick updates and a couple notes about some work we're undertaking that you may be interested in. Just a quick reminder on waiver updates. We did have, and we talked, I think at the last meeting, about the assistive technology equipment update to the rule. We are well underway with implementing those changes. So you are likely seeing revisions to plans. Even if you're not the provider of the assistive technology equipment, you're going to see a revision likely coming through. So we're still working on those. Just a heads up, that's happening. On sort of a related note, we are undertaking, I don't know if I want to call it a project or initiative. I don't know. Never know what to call these things. But we are working with a couple of our assistive technology equipment, and more importantly, remote support providers, and Station MD, which, if as a reminder, is the only current certified provider for the healthcare assessment service. And what we're looking to do is perhaps bring in some other providers that of remote support that might be interested in working with us. We're trying to look at, for those receiving remote support, we know they're already comfortable using some level of technology. We're looking at, are they people who might benefit from, based on their situation, might benefit from using healthcare assessment? So looking to potentially increase the number of people accessing that service. I think it's a very economical and maybe even more importantly, really convenient way for our people and for the people supporting them to get linkage to some healthcare services. And just as a reminder on healthcare assessment, I know we've talked about it here a few times, but that service, it's basically a telehealth service that we can authorize under the waiver, where the person and their caregiver can use that service to access a doctor that specializes in treating people with DD. And that can be for urgent or potentially non-emergent, but things that are going on outside of their visits to their primary care. So someone's sick, they're trying to decide, do we need to go to the ER? Is this something we can stay here with? What's the best course of action? Any of those kinds of things you might go to an urgent care for outside of your routine appointments. And we know that many of our folks really struggle with those environments, right? It's not a pleasant experience for many people. So this is a really nice way to get some of those needs met without having to, go deal with the ER or an urgent care or things like that. The other really great benefit, I think, of the service is the follow-up they do. So if you do need to go on to the ER, they do that. They call ahead to the hospital and they do that linkage so that the staff there are prepared for our person who's coming and maybe can have a better experience for them if they do need to go to the ER. Likewise, they follow up with their primary care physician. So there's that continuity of care and linking them with those services. So I just wanted to give a little plug out for that and let people know that we are working on just looking at those with remote support, kind of got to start somewhere, right? So looking at those folks, we know they're comfortable with technology. Their providers are likely already interfacing with it. Are they people who might have a need for this service? And if so, let's potentially look at authorizing it for them. So if you're a remote support provider and you're interested in joining us in that work and looking at the folks you're serving, please email Lindsay Shapiro. Karen, I didn't ask you this. Would you mind putting her email in the chat? Lindsay's one of our SSA supervisors. She's very interested in this work, and she's helping us work with our provider community on the initiative. I see Jamie Miller, our nurse extraordinaire, is on here. I know Station MD is near and dear to her heart with healthcare assessment. Jamie, did I miss anything you'd want to point out? I should have asked you earlier.
No, you did a great job. I just completely agree. It's an incredibly beneficial program, and providers will get a lot of support if that's in place. And I guess one thing I would add is that it is, once you're signed up for the healthcare assessment, it's available to anyone on that individual's team. So it can be used from, if they're home visiting their family for the weekend, if they're at a day program. So it's really great in that sense that it's available to anybody who's working with that individual. So
yeah, thanks, Jenny. That's a really good point. So, and at what I would consider, I know we're talking about budget. It might seem strange. We're talking about our budget, and I'm here saying let's potentially increase the use of a service, but for what you're getting in terms of the cost to the system as a whole, it's what, $34 a month, I believe, or something real close to that. It's a very cost-effective service for what people are benefiting from. And, it's a lot less costly to the whole system than going, obviously, to the urgent care or the ER. We all know how expensive that can be as well to the system. So anyhow, if you're interested, email Lindsay. She's working with us on providers, remote support providers. Thought we'd start there. Happy to have you if you want to join us. So that's that project we're working on. Let's see, what was my next thing? Oh, okay. I just want to briefly touch base on, I can't really tell from the login how many independents we might have on here. It looks mainly like agencies from the faces I know, some familiar faces out there. Cindy Wright, I see you. Hi. Just want to let people know some work we're doing around independent providers and overtime, and give you a little background on what we're doing and why, and how it might affect agency providers potentially. So we are doing a little bit of work around looking at our authorizations where we have independent providers on a routine schedule, meaning on a regular basis, authorized for over 40 hours. When that's occurring and they're providing those services, they are billing overtime. And as a result, that obviously is a higher cost. So we are very fortunate in our community to have many of you and others a great provider pool. And so we are working as hard as we can to start addressing those and looking for other options. So what you might be hearing, independent providers did receive a memo just letting them know we're starting down this path, we're starting to work on this. SSAs are being asked to start looking at the people they're serving when there is an overtime situation. And we're going to be having team meetings to talk about where can we make changes that will continue to meet that person's need? Back to what Leah said earlier, very important, right? We're not cutting hours to people through this process. We are looking at meeting that need another way that does not then involve billing of that higher cost, that overtime. So what that might mean for you, the providers that are on here today, particularly the agencies, you may see an uptick in our provider searches that are coming out as we're looking to fill those hours. So you may see that. Likewise, independents will likely see that. I just don't think there's too many of you on here. I think it's mostly agencies this morning. But you may see that, and I just wanted you to know that's out there, and that's something we're working on. We are, as with everything we do, approaching this in a very person-centered way, understanding that these changes may be tough for people. Understand that it may be tough. You know, Dawn may work with Karen for a very long time and maybe doesn't want to make that change, but just because she really likes her doesn't mean we can leave this alone, right? So we really do need to look at that over time. Try to find something that still meets your need. Maybe Jenny's out there, right? Not going to yank the rug out from under people. We are giving some timelines to try to find solutions. So we're asking teams to, within 60 days, find a solution, like what is the plan? And then we're giving a little more time for implementation. Understanding that, you know, Dawn's situation may take a little longer than Angie's. My situation may take a little longer than both of those. But we have to start somewhere. And I always tell people we're like the Titanic, right? We're a very big ship. If we don't set some parameters, we'll never get anywhere. So I am setting timelines for teams to start doing some of this work, with the understanding that we're going to have exceptions, right? We're going to have things that fall outside of that, but we have to have some sort of guidance to get through this, or we won't make any progress. So again, back to the question somebody asked earlier, how can you help? Really love your cooperation and help with this as much as possible. Help support us as we navigate these. I know many of them are going to be difficult situations. I am pleased to say, I was just looking this morning at, we just started this and we have a tracking, and I was looking this morning at some notes from some of our wonderful teams, and already we do have some providers who are really stepping up and helping us find some solutions. So I really appreciate that work from those of you who've been already involved, and really will appreciate support as we move forward. So I did want to let you all know about that. As we've done in previous kind of project work, we have, if people are running into a bind and they're saying they're not finding some, we would like to have sort of a list of people, providers that we know are actively able to take on new business. So if you are interested in potentially being considered for such a list that we're going to work on compiling over some time here, please email provider support. Karen, do you mind dumping that in the chat? Appreciate it. Thank you. If you are willing, have the capacity to take on business and feel that you might be able to be on that list, please let us know. We'll be working on that over the coming weeks and months. So that was the piece I wanted to share about that. Again, really important to understand. We are not issuing any kind of directive to reduce the person's hours. If those are the assessed needs, we want to continue to meet those needs. We're just going to need to look at some creative alternatives. The direction we're giving people, just to be clear, is if there's already another provider authorized that's familiar with that person, already serving them, particularly if there's an agency, we're going to start there, right? So we're not going to do a provider search when there's already a provider potentially there that knows the person. We're starting with that, whether it's an agency or an independent. If there's another independent that's not at the 40-hour mark, we'll be looking to them as well. If those things don't work out, then we'll be doing provider searches. So just kind of let you know the flow, what we're asking people, how we're asking them to approach these situations. So did I miss any questions, or is that just you putting the emails in there, Karen?
Just me.
Okay. Well, I think that's all. Karen, did I miss anything you wanted me to cover this morning?
I don't think so. I think you covered it.
All right. Well, those are the things, some of the highlights of things we have going on. It was good to see some familiar faces. Jessica, I see you out there. Good morning. But I always like to see you guys. I don't get to see as often as I'd like. So great to be here. If you have any questions or things come up as we're working through these initiatives, please reach out. We're happy to assist and try to answer any questions. Thank you.
Thank you. Thanks, Jen. And the final thing we have on our agenda is for agency providers specifically. It is for the annual reporting requirements. Jenny.
Yeah, just a couple of quick reminders. Providers, agencies are required to do your annual analysis. That needs to be sent to the MUI department no later than February 28th. So you still got a few weeks to get that in and get that done. And then look for an email from me soon. Save the date for our annual MUI analysis. So I'll be sending that out to you guys, and we'll probably just do it Zoom again. We get a lot more people involved when we do it that way. So watch for that. A couple of, just remember, if there are any independents on here, you are no longer required to do your annual analysis. So when rule was revised in July, they took that part out. So you're off the hook. So you don't need to worry about doing that. And then just a couple of other quick things I wanted to mention. One is just as a reminder, I think people are overall doing really, really well with this, but any category C case, so law enforcement, unanticipated hospitalization, and unapproved behavioral support, please remember that it is mandatory that that appendix form comes with the incident report. We've had some not meeting some timelines or deadlines because that's not coming in at the same time. We know you're busy. We know that it's a lot of it is duplicative. I recognize that. Just make sure that you're sending that in at the same time, and we'll be good to go. The other thing that I wanted to mention is that remember that Hamilton County MUI is not part of BritCo. So you cannot submit incident reports through BritCo to us. We've been getting some reports from providers saying, I sent it through BritCo. We don't receive it. It's out there in just, somewhere in no man's land. So please don't use BritCo to submit incident reports. You need to email those in, fax them in, whatever, however, what's the, the easiest way. We prefer email. The other thing is that if you think something is an MUI or you have questions about something that you have submitted and you have not heard back from us, please reach out. We have tried to do, the best we can to make sure that we touch base with everybody, let you know if it's an MUI or a UI. Having said that, Melinda, who is kind of our frontline person, on any given day, she can have 75 to 100 emails before noon. So something might get overlooked, right? So if you have a question, please just don't assume that we have it or we received it or we've called it an MUI or UI. Please reach out. We're happy to help, clarify that anytime that we can. You can email us, you can give us a call, whatever the case may be. So I think that's all I had.
Jenny, did I put the right phone number in the chat? 6629?
Yes, that is correct. Thank you, Karen. All right, I think that's all I have. It's great seeing everybody.
I think that's all we have on our agenda. Anyone else have anything to share for the collective? Any invitations or anything? Any questions? All right, it's great seeing so many of you today. A few of us will stay on, so if you have any questions and want to ask in a smaller group, we're here for you. Thanks. See you in 2 months. Thank you, everybody.
Bye, guys. Thanks.